Imagine this situation. You're at home, maybe sitting quietly, watching television, or reading something familiar. Everything feels normal, and then, without warning, your body begins to send strong, unusual signals. Pressure in the chest, discomfort spreading through one arm, breathing feels harder than it should. When something like this happens and no one else is around, the most important thing isn't panic. It's knowing what to do next. What many people don't realize is this. In moments like these, the first minute matters more than most people think. Research published in respected European medical journals has shown that older adults who know how to respond calmly and correctly in the very beginning are far more likely to stay stable until help arrives. And yet, studies also show that the majority of people over 60 have never been taught what to do if they are alone when their body sends serious warning signs. Many freeze, some rush, others try random actions that don't help and may even make things harder. Today, I want to walk you through 7 practical, evidence-based steps that can help you stay in control during a cardiac emergency when you're by yourself. These are not internet myths. These are not dramatic tricks. They are simple actions, supported by emergency medicine research, designed to help your body stay as stable as possible while professional help is on the way. One of the steps near the end is so effective that emergency dispatchers are now trained to guide people through it over the phone. And interestingly, it has nothing to do with medication. Let's take this step by step, calmly and clearly. Tip number 7. Create your emergency communication system. This may sound basic, but it's one of the most overlooked parts of emergency preparation. During a cardiac event, oxygen levels to the brain can change very quickly. Within seconds, people may feel confused, disoriented, or have trouble focusing. This is not a personal weakness. It's simply how the body reacts under stress. In fact, emergency medicine research has shown that many older adults struggle to remember simple information like their address when calling for help during these moments. That's why preparation matters. Here's what I recommend doing now, not later. Write your full home address clearly on a bright piece of paper. Include apartment numbers, gate codes, or special entry instructions if needed. Place this paper next to every phone in your home. Program emergency services into speed dial on your phone. Yes, the number is simple, but when hands are shaking or coordination feels off, pressing one button is much easier than dialing several. Keep your phone charged and close to you, especially at night. Many serious cardiac events happen during late evening and early morning hours, when phones are often left in another room. If you live alone, consider a medical alert device. And if you have one, wear it consistently, even in the shower or while sleeping. Many modern devices are waterproof, and that small detail can make a big difference. It's also wise to inform a trusted neighbor, building manager, or doorman if you have heart-related concerns. Giving someone a spare key or letting them know your routine can help emergency responders reach you faster if needed. These steps don't take long, but they create a safety net around you before anything ever happens. Tip number 6. Understand the cough breathing technique. There is a lot of confusion around this topic, so I want to be very clear and responsible here. This technique is not a replacement for calling emergency services. It is not something to rely on long term. However, in very early moments, while you are still conscious and waiting for help, controlled coughing combined with deep breathing may help maintain circulation for a short time in specific situations. Medical studies have shown that when used correctly and briefly, this method can help some people stay alert long enough to make a call or take the next step. Here's how it's generally described. At the first strong warning signs, take a deep breath, filling your lungs as fully as you comfortably can. Then cough firmly from deep in your chest, not your throat. The movement should feel strong and deliberate, not forced. Repeat this cycle slowly. Deep breath, strong cough. Deep breath, strong cough. Each breath brings oxygen in. Each cough creates pressure that helps move blood through the body. But this is critical. This technique is only meant to be used while waiting for emergency assistance, and only if you remain conscious. It is not appropriate for every situation, and it should never delay calling for help. Emergency experts emphasize that knowing about this technique ahead of time is important because there is no opportunity to learn it during a stressful moment. Preparation is always calmer than reaction. Tip number 5. The aspirin approach. Many people misunderstand. You've probably heard that aspirin can be helpful during certain cardiac situations. But what many people don't realize is that how it's taken can matter just as much as whether it's taken at all. Research from major cardiology publications has shown that aspirin can help the blood flow more freely during a cardiac event by reducing how easily blood cells stick together. This may help limit how much strain the heart is under while help is on the way. What's important to understand is this: aspirin works faster when it's chewed rather than swallowed whole. When you chew it, absorption begins in the mouth instead of waiting for digestion in the stomach. Studies have shown that this difference can significantly reduce the time it takes for aspirin to enter the bloodstream. The commonly recommended emergency amount is equivalent to 1 regular strength tablet or several low-dose tablets, chewed slowly. The taste may be unpleasant, but speed of absorption is the goal in that moment. It's wise to keep non-coated aspirin in several easy-to-reach places, near your bed, in the kitchen, and even in a bag or wallet if you're often out. Check expiration dates regularly, as old aspirin can lose effectiveness. However, this is very important to say clearly and responsibly. Aspirin is not for everyone. If you have an allergy to aspirin, or if you've been advised by your healthcare provider to avoid it due to bleeding risks or specific medications, you should follow the plan that was created for you in advance. Preparation means knowing your own guidelines before an emergency ever happens. Tip number 4, use a supportive body position. Your body position during a cardiac emergency can influence breathing comfort and circulation. Lying completely flat can sometimes make breathing feel harder and increase discomfort. Instead, emergency care guidelines often suggest a semi-upright position when possible. Here's what that looks like. Sit at about a 45-degree angle, supported by pillows, a couch back, or a wall. Keep your knees bent and your feet resting comfortably on the floor or bed. This position can reduce strain on the heart, make breathing feel easier, and help prevent fluid from building up in the lungs. If at any point you begin to feel lightheaded or unstable, lower yourself slowly to the floor. Don't rush. Use nearby furniture for support if needed. Once on the floor, turning onto your side, often called a recovery position, can help keep your airway clear if nausea occurs or if you become very weak. Also take a moment to loosen tight clothing. Unfasten belts, collars, scarves, or anything that feels restrictive. Even small changes can make breathing feel less labored. Keep the room cool and well ventilated, but not cold. If you're sweating, avoid heavy blankets. Overheating increases the body's workload, which is the opposite of what you want in that moment. These positioning choices don't solve the problem, but they can help your body stay more stable while waiting for professional care. Tip number 3, use controlled, calming breathing. When the body senses danger, it naturally tries to breathe faster. This reaction is automatic, but during a cardiac emergency, it can make things harder by reducing how efficiently oxygen is delivered. Medical research has shown that slow, controlled breathing can help the heart work more efficiently and reduce unnecessary strain on the body. Here's a simple method that emergency specialists often recommend. Breathe in slowly through your nose for a count of 4. Let your belly rise more than your chest. Hold that breath gently for a count of 4. Then breathe out slowly through pursed lips for a count of 6, as if you're blowing out a candle very slowly. The longer exhale is important. It helps activate the calming part of your nervous system, which can slow the heart rate and reduce tension. Place one hand on your chest and one on your abdomen. If the hand on your abdomen is moving more, you're doing it correctly. If possible, count out loud. This helps keep a steady rhythm and also lets emergency dispatchers know that you're conscious and breathing. This technique works best when it's familiar, which is why practicing it occasionally when you're calm can make a real difference later. Tip number 2, Unlock access and signal for help early. This step is simple, but incredibly important. If you notice strong warning signs and you're alone, unlock your front door as early as possible. Do this while you still feel steady on your feet. Emergency response research has shown that delays often happen when responders arrive but can't get inside quickly. Unlocking the door early removes that barrier. If you're able, turn on lights in your home. A well-lit house is easier to identify, especially at night. If you live in an apartment or building with security, call emergency services first, then contact the front desk or security office to let them know help is coming and where you are. Some people choose to install lockboxes or smart locks that allow emergency responders to enter without delay. These systems can save valuable time and are worth considering if you live alone. You can also keep a simple emergency information sheet inside your front door. Include your name, medications, allergies, and any important medical notes. This helps responders act more efficiently once they arrive. Tip number 1. Follow your personal emergency medication plan. This final step is about preparation, not improvisation. Some people have been prescribed emergency medications, such as nitroglycerin, for chest-related symptoms. When used correctly and as directed, these medications can reduce strain on the heart and improve comfort while help is on the way. The key is using them exactly as you've been instructed. If you've been prescribed such medication, you should already know when to take it, how to take it, how many doses are appropriate, and when to seek emergency help. Regardless, never experiment or guess during an emergency. Preparation means discussing this plan ahead of time with a healthcare professional and keeping the medication stored properly and within reach. It's also important to be aware of interactions. Some medications should not be combined with others taken within a certain time frame. Keeping a list of your current medications in your wallet or near your phone can help responders make informed decisions. If you don't have a personal emergency medication plan, consider discussing one during a routine medical visit. Being informed ahead of time creates clarity when clarity matters most. Closing thoughts. These 7 steps are not meant to replace professional care. Their purpose is to help you stay as stable, calm, and prepared as possible while help is on the way. Preparation doesn't create fear. Preparation creates confidence. Take time to review these steps when you're calm. Make small adjustments in your home. Practice the breathing. Check that important items are where you expect them to be. And if you know someone over 50 who lives alone or spends time alone, consider sharing this information with them. Being prepared is one of the most practical ways we look after ourselves and the people we care about. Thank you for spending this time with me. Stay aware, stay prepared, and take good care of yourself.